Okay, if you're a parent or a caregiver, you know exactly what can instantly spike your anxiety. It's finding a sudden, mysterious rash on your kid's skin. It is literally a terrifying moment, right? But I want to validate that worry right out of the gate by acknowledging a simple fact. Almost every single child is going to get a rash of some kind at some point. The great news here? Most of them are completely harmless. They're usually just caused by common viral infections or minor skin irritation. But you still need to know how to spot the exceptions. So, in today's explainer, I can enthusiastically promise you this. By the end of our time together, you are going to be empowered with the exact knowledge you need to confidently evaluate a rash and know exactly what to do next. So let's dive into this. Here is our roadmap for the explainer. First, we'll cover common and harmless rashes. Second, the critical glass test. Third, recognizing urgent red flags. And finally, routine care and next steps. Starting with Section 1, common and harmless rashes. Basically, your green light. We really want to lower the temperature here and ease your worries right off the bat. Most childhood rashes actually fall into a few very familiar, highly manageable categories. For example, viral rashes are usually flat, blotchy, and widespread. They often pop up alongside a mild fever or cold-like symptoms. Think of things like roseola, hand, foot, and mouth disease, or slapped cheek syndrome. Then we have chickenpox, which shows up as small, extremely itchy, fluid-filled spots that appear in crops and spread out over a few days. Now, if it's warm weather, or maybe you've got a baby who's a little overwrapped, you might see heat rash. Those are just small, red bumps hiding in the skin folds. Eczema usually shows up as dry, itchy, thickened patches sitting right in the skin creases. And finally, hives or urticaria, which are raised, itchy welts that can literally move around the body. Those are usually sparked by an allergic trigger or a viral infection. All of these, they're generally not dangerous and improve on their own or with really simple treatments. But as harmless as those are, we really need to pause here. There is one absolutely crucial exception to everything we just talked about. It's an exception that every single parent and caregiver absolutely must be able to recognize. We are now shifting from harmless irritations to what can be a critical medical emergency. Which brings us to Section 2, the critical glass test, your emergency tool. I want to speak directly to you right now. If your child develops a rash, this is the definitive test you need to perform. You must check for a non-blanching rash. So what does that mean? It means a rash that does not fade or disappear when you press on it. This specific type of rash can be a warning sign of meningococcal septicemia. That's a form of blood poisoning linked to meningitis, and it is a true medical emergency. Just to give you an idea of what to look for, a non-blanching rash might start out looking like small red or purple pinprick spots. Doctors call those petechia. But if it's left unchecked, it can progress really rapidly into larger bruise-like patches called purpura. So here's how you actually test for this. The steps are super precise. First, take a clear drinking glass and press the side of it firmly against the rash on your child's skin. Second, look directly through the glass at the skin underneath. Third, just observe the spots. If the spots or the rash are still clearly visible right through the glass and they don't fade away under that pressure, it is a non-blanching rash. You are looking for a rash that absolutely refuses to turn white or fade away when squeezed. Now, here's a vital medical fact that is incredibly important if you're caring for a child with darker skin. A non-blanching rash can be much harder to spot on darker skin tones. So your crucial check is to look at the paler areas of their body. Check the palms of their hands, the soles of their feet, or even gently pull down and check inside their eyelids. And honestly, above all else, always rely on how unwell your child actually seems to you, not just what you can see on their skin. You know your child better than anyone. And I really want to emphasize this heavily because it is such a commonly misunderstood point. Septicemia, that dangerous blood poisoning, can occur before any rash ever develops. Do not wait for a rash if your child is seriously unwell. If they're really sick, don't just sit around waiting for skin changes to validate your concern. The rash is a symptom for sure, but it is not always the first symptom. Let's move on to Section 3, recognizing urgent red flags. Because listen, a rash isn't the only warning sign. We need to look at the whole picture. You need to seek emergency help immediately if a rash, or honestly just a general sense of severe illness, is accompanied by any of these features. Are there neurological signs, like a fever paired with a stiff neck, or they're uncomfortable looking at bright lights, or maybe a severe headache? Look at their skin and extremities. Are their hands and feet cold even though they have a high temperature? Is their skin looking pale, mottled, ashen, or maybe showing a blue tinge? Pay close attention to their energy and breathing. Are they unusually drowsy or really hard to wake up? Are they letting out a high-pitched, unusual cry? Are they breathing rapidly or struggling to breathe at all? Also, watch out for a rapidly spreading rash, a child who just seems to be getting worse very quickly, refusing fluids, or having noticeably fewer wet nappies. Let me be perfectly clear. Any of these features, whether there's a non-blenching rash or not, absolutely warrants an urgent medical assessment. And this brilliantly illustrates the exact divide we've been talking about. If the rash fades under pressure, you can safely book a routine GP appointment or consult a pharmacy first. But if the rash does not fade under pressure, you call 999 or go to A&E immediately. You do not wait. There's zero middle ground here, and having this really clear rule takes all the guesswork out of an incredibly stressful situation. Finally, Section 4, routine care and next steps. Okay, let's take a deep breath and bring the energy back down to a calm, reassuring tone. Thankfully, most of the time, you aren't going to be facing an emergency. A routine appointment is perfectly enough if the rash fades under pressure, meaning it blanches normally. It's also the right step if your child is otherwise acting totally well, they're feeding normally, and they're completely alert. Routine care makes sense if the rash is simply itchy, like eczema or hives, but there's no fever or any of those other concerning symptoms we just went through. Or, if the rash has just been hanging around for a little while without spreading or getting worse. In all these scenarios, you can take a breath. Routine care is the right call. Oh, and here is a highly practical pro tip before you head into that routine appointment. Photograph the rash as it develops. Getting a timeline of photos on your phone is genuinely so useful for a clinician. It allows the doctor to see exactly how the skin is changed over time, which can be incredibly helpful for diagnosing those harmless viral rashes or allergies. Let's bring it all together with this quote. Most childhood rashes are harmless and settle by themselves, but knowing the glass test could make the difference in an emergency. This is the absolute core message of our explainer today. You now have the knowledge and the structured understanding to protect your child, categorize the danger, and act with total confidence. So, I want to leave you with this final thought. If a rash doesn't fade, or your child seems seriously unwell, will you wait and see, or act immediately? By now, you know the answer. You absolutely never wait and see with a non-blanching rash or a seriously unwell child. You act. Thank you so much for joining me for this explainer. Stay observant, and I'll catch you next time.